Okay, so I am so happy that I am here with two outstanding plastic surgeons from Chile and from Brazil. Okay, so I've had the fortune of having them with me in the OR this week, and it's such an opportunity to have the chance to speak with outstanding plastic surgeons that come and visit. First of all, we have Dr. Nicolás Pereira. He's from Santiago de Chile. And we also have Marcelo Cury from Rio de Janeiro from Brazil. So thank you so much for coming over to Madrid and for having this opportunity to just have a short conversation. All right. So first of all, I want to ask you, you are both very, well-rounded plastic surgeons. You, Marcelo, you are the head of the department in oculoplastic and orbit surgery in Rio, one of the largest hospitals there in Brazil. And tell me a little bit how you came to be this specialized in this complex reconstructive surgery that orbital reconstruction is, right? How did that happen?
So first of all, thank you very much, Dr. Bravo, to having us here. It's such an opportunity for us to learn from one of the best of the world. So thank you so much. It was incredible day on OR.
Thank you.
Full facelift surgery. So my history in oculoplastic surgery started when I was training with Dr. Pitangui, and he had a very big team in specific fields. So that time, Dr. Roberto Sebastian and Dr. Sergio Lessa, who worked with Dr. Pitangui in this specific field, and I started to see the surgeries and to have interest to learn more about the oculoplasty and this complex cases about ortho and eyelid and lacrimal system surgery. And then I had the opportunity to do my first specialization with Dr. Roberto Sebastian in Federal University in 2009.
Wow.
So almost 20 years ago.
Wow.
And then I started to specialize in this field and travel abroad to US to see other surgeons. Yeah.
It's very unique, right?
Yeah, but I think it's very useful and it's good for both, for us plastic surgeon and for them
Right.
ophthalmologists, because as I usually say, they have the patience, because the patient who has ectropion, who has orbital tumor, who has entropion, who has ptosis, they have eye symptoms.
Right.
Eye symptoms. They tearing. They have eye irritation. So they look for ophthalmologists.
Of course. Yeah.
Yes. And us as a plastic surgeon, we do a lot of big surgeon, orbital surgeries, and so bone surgery. So we have the specialization to treat the complex case.
And complement them and really solve really complex cases.
Yes,
no, of course. Huh? And Nicolás, you have a similar background, right? You're one of the outstanding specialists in microsurgery and at very advanced supra microsurgery, right? And tell me how you got into that field, right? Because you are one of the top. Again, supra microsurgery, you're doing lymphedema, you're doing very advanced microsurgery. I know you did some training even in Asia. So how did you get into that field of advanced reconstructive surgery?
Well, first of all, thank you very much for having me here.
Thank you.
It has been a very nice week, and thank you for your generosity, sharing your knowledge and tips and tricks in this kind of surgery. That it's very interesting to know how to fix the aging stigma, and it's very connected with what I do in reconstructive surgery. I train in Santiago in Chile. I studied my medical school, then general surgery, a master degree in biological science, and also plastic surgery. But then I went abroad because you must see different realities and how you approach to different patients, and especially in your reconstructive field. Nobody in Chile was doing lymphedema surgery or super microsurgery. So I trained in Barcelona and also in Seoul, Korea. And microsurgery and super microsurgery is a very detailed type of surgery. You need a lot of accuracy. You must do a lot of pre-planning, a lot of thinking how to fix the problem. And I think that in this field of cosmetic surgery, in facial surgery, accuracy and details are what takes you to the next level, and you will have the result that patients are looking for. So that's why I think that facial surgery, specifically in cosmetic, is very related with reconstructive and in high level of reconstructive surgery. I mean, super microsurgery. And that's why I'm here, because you are one of the most important facial surgery in the world. So that's why I'm trying to learn and to have this kind of knowledge.
No, I think I agree, Nicolás, very, very much with what you said. I think that, a lot of, maybe younger surgeons think that, the best thing to do is to go right away into aesthetic plastic surgery. But I have to say also, my background also was in reconstructive microsurgery, very complex procedures. And I cannot think enough that training, because as you were saying, Nicolás, that attention to detail, that patience, that knowledge that every little stitch can make a difference, right? Like in microsurgery, it can ruin, or in advanced reconstructive surgery, like you're doing, lacrimal gland, thyroid disease, decompression of the orbit. These are very complex surgeries, and the good thing is that, maybe you don't know there, but, both Nicolás and Marcelo are outstanding, facial rejuvenation surgeons as well. And they're some of the top, facelift surgeons in their cities, both in Santiago de Chile and in Rio de Janeiro. And this just shows that their commitment, and I think that it goes with the commitment of an advanced reconstructive surgeon that you are, with countries with incredible culture in aesthetic plastic surgery. You train with Ivo Pitangui, and in Chile we've got that school with Pedro Calderón and Patricia Andrades, who are surgeons that have contributed so much to the field of plastic surgery. And now you see this sort of drive to continue to learn and advance, while a lot of reconstructive surgeons would oftentimes look down at aesthetic surgery, right? Don't you think so, that is sometimes a problem? But you definitely do not have that issue, with being acknowledging aesthetic plastic surgery as a complex discipline, right?
I think they complement each other, and it's very important to have the background of reconstructive surgery, and because it teaches us to see the preoperatory, to make a very detailed pre-op assessment, and I think it's very complement the reconstructive and the static surgery.
Right. What do you think, Nicolás? Also,
I think it's probably the most important thing in cosmetic surgery is to have a reconstructive background. The anatomy, of course, is the same.
It's essential,
but it's essential. You cannot do aesthetic surgery without knowing the anatomy and knowing every maneuver you do to have the result you want to have. So that's why I think you are very lucid in knowing every stitch or every movement of the different planes will take you to what you're looking for, and that's a detail we were talking about before.
Right. No, definitely. And then you also, you work also with other specialists, especially with orthopedic surgeons, right? So
I usually do orthoplastic surgery. We call it like that. When you work with the orthopedic surgery in high energy trauma, and you need to fix the extremity to save the extremity.
Right.
And my work there is to save the soft tissue and reconstruct.
Well, I have to say, to mention both of you that, that, for example, that type of microsurgery for me was the most complex, right? Lower extremity trauma, because, even if you do a perfect anastomosis, there's so many things that can go wrong with that limb. So that just shows you how complex that is. And in your case, for example, I have the utmost respect for eyelid surgery, especially for lower blepharoplasty, because again, that is such a complex procedure with so many things that can go wrong, that can produce lower lid retraction. So it just shows you how much, despite that advance, and both of you are like incredible international speakers. You've been just here at our meeting in Zaragoza, our national, invited as an international speaker, and you're going to speak now in the European Society meeting, right, in microsurgery. So again, I'm very fortunate to have you both, because again, I really enjoy, during these cases, the insights of plastic surgeons that are so well trained and so internationally also renowned. It's really, I think, very, very enlightening for me to have you in the OR. Tell me a little bit more, though, about how do you see the future of aesthetic plastic surgery regarding facial rejuvenation? Again, you have that background, you're incredible, outstanding reconstructive plastic surgeons. You're still involved in academic, high-level reconstructive surgery, both of you. And you're very active, very advanced, facial aesthetic plastic surgeons with very good facelifts that you both do. Do you think that there will be a moment where you will have to sort of let go of part of your broad spectrum of procedures that you now are doing, or do you think that is perfectly plausible or perfectly doable, to be able to keep both parts of your practice?
I think it's possible to keep both part of our practices. If you have a very good training, if you have a good background about, of course, aesthetic and also reconstructive surgery, and you can do both. I think the best surgeons I know in the world, they had at least part of their life doing reconstructive surgery, as you have done, as Dr. Nicolás and many others. So I think it's very important for us as surgeons, at least a part of our life dedicated to both. Mm-hmm. And then, of course, life change and you focus in such field. The life changed, but I think it's very important, at least a part of our life.
What do you think, Nicolás, about that? Will you be thinking that it's more that you will end up doing just facial rejuvenation surgery or not?
That's a very interesting question, because that's probably the most beautiful thing in plastic surgery, that in the morning you can be doing a reconstruction of the foot, and in the afternoon you are doing a facelift. So you can do everything around the body. But I think life will take you to the place you need to be. Patient will look for you for what you are doing best. So definitely at the end you will do just a few things. A lot of that, but just a few procedures to master them and to give the best results. Well,
I think it's true that a lot of times the tendency, I don't know if you agree, that more and more patients are looking for ultra super specialists in one area. And although it's true that sometimes when you have someone that only does, ptosis surgery or just one type of procedure, then probably he's going to be quite good at it, right? But I think it's also true that a lot of patients don't understand that when you have a good training in a procedure and a good background, and you've done, oculoplastic surgery, you've done microsurgery so long, the fact that you're doing that procedure does not, deter you from being a great facial rejuvenation surgeon, right? Like you both are. So I think what it takes is that you understand, as very advanced plastic surgeons that you both are, that you need to take it seriously when you're doing a difficult procedure, like we just did today, a hard face and neck lift in a very hard patient. I think that if a surgeon like you understands how complex it is to produce results in those cases, and you've come over here just to because we are all improving, and every day we want to make things better for our patients. But the fact that you're here just showcases how dedicated you are to your specialty, right? To getting results like you both are. And you don't have to be doing, 10 faces or 10 facelifts every week to be good at it. You have to understand that you have a good background in aesthetic plastic surgery. You understand anatomy around the face, and you understand beauty and youth and youthfulness, and you know how to achieve it, with these complex procedures. But again, I think a lot of times patients still think, if they're doing in a hospital and he's doing, hard reconstructive cases or micro cases, then he can't be doing a good facelift. But the fact is, you both do incredible facial rejuvenation procedures and great facelifts and neck lifts, both of you. But again, you keep that sort of ability to be able, I think it's sort of like, don't you think it's sort of like cooking, a good chef will be able to do a fried egg and also a good meat, but the fact that he only does one thing, still doesn't mean that he can't do other surgeries, right? So I think that it's important to have that all-round type of surgery. Tell me a little bit about your cities. Now, a lot of surgeons are now, especially younger, that are starting out, they get advice from, and I've heard it from colleagues going from meetings, and they say, "Oof, you shouldn't go to that city. There's too much competition. Are you crazy?" Rio de Janeiro, Santiago de Chile, they're the two most competitive cities probably in Brazil and in Chile. Tell me what is your opinion on that? How do you see that?
Yeah, it's hard, specifically to start your career. So it's not easy. There are a lot of plastic surgeons, but I think if you dedicate yourself for some specific fields and be a very, very good surgeon, and of course wait the time it takes. We are seeing surgeons nowadays. They want to be the superstar with 5 years on career. It's impossible. It takes time. It takes white hair. So, So I think there is space for everybody doing the right things and with ethical. And of course, resilience and growing up and patience and being 1% better every day, as you said. That's our life. So, but on my field specifically, oculoplasty, there is a big field to navigate because there is no. The number of the surgeon very good in this field is not so high. So in Rio and São Paulo, I think maybe in Madrid. Or
definitely, Santiago, it's a very niche area, right?
There is space, I think.
Nicolás, what do you think about Santiago de Chile?
I think, the difference between Santiago and Madrid or Rio, that Chilean Society of Plastic Surgery is not that big. We don't have, probably we are 150 board certified plastic surgeons, so it's not that big. So our competition are the intrusivism, the non-certified plastic surgeons. Okay. And that's why these visits or this kind of training are so important, because that make the difference between good results and bad result, and not only bad result, but sometimes very bad complications.
Complications, right.
So that's the most important thing, that we need to make the difference with the non-specialized or non-certified surgeons that are
Right.
doing things that sometimes are very non-ethical.
Right. No, that is an issue. No, but definitely. So, and how about, what do you guys think about this? Then what the surgery? No, that it's we did a very complex case today, right? But I hope it doesn't deter you to keep on doing the surgery. I mean, you guys do very complex surgeries, right? But I think it's sometimes, these cases, it's what you have to do, right? Don't you think that sometimes these very complex facial, rejuvenation cases, they require a lot of, little parts and maneuvers, right? That are a requirement to get the result that we were looking for. No, what do you think about that?
Yeah, it was a very, very nice surgery and very complicated case. One of the most complicated I ever seen. Mm-hmm. And yeah, you did it very, very well, with very detailed, and yes, doing what you have to do. Yes. And this is, I used to say that the outstanding results, it's a sum of a lot of details. It's not just one thing.
Yeah.
So you have to do what you have to do, and yes, congratulations, amazing surgery.
Thank you so much, Cury. Yeah. How about you,
Yeah, I think it was a very difficult case with an amazing result. At least immediate post-operative.
Right on the table.
Great, amazing, and probably the thing that makes the difference is to be obsessed with excellence, to be obsessed with good results, and to do things well. How would you have to do it? And you keep your energy and attention from the beginning until the last stitch, and probably it was like 9 or 10 hours.
It was long to taste today. Very complex.
That's admirable. I think that kind of details are not details, are the right way to do it.
Yeah, I think at the end you're right, and both of you, it's and that's why your background in these complex surgeries, that oftentimes they're a huge challenge, right? And I think that's what makes a lot of us that have that background in very complex reconstructive surgery, I think it's what attracts us into facial rejuvenation surgery, because as you both were saying, facial rejuvenation, a lot of people think that it's, a little fast thing, just pulling on the skin and that's it. But when you try to understand how to, achieve that definition on the jawline, that depth of the submandibular region, and that tightness around the face without having it look artificial or without pulling on the skin, it's very hard, right? It's complex. So then at the end of the day, I think that that having that background, like both of you have in reconstructive surgery, sets you up to really achieve good results in facial rejuvenation surgery. And I think that's why both of you are doing these complex reconstructive surgeries, but also you're doing outstanding facial rejuvenation surgery, both in Rio and Santiago. So, Dr. Pereira and Dr. Cury, thank you so much, both of you, for being here in Madrid, and for such an enlightening day today and the rest of the week. Thank you so much.
Thank you so much, Dr. Bravo. Incredible opportunity.
Thank you. Thank you so much. Wonderful.
Good to see you.
Okay.